Thanks, Cathaoirleach. And at the outset, can I echo the comments by colleagues in relation to access to drugs, expansion of the heel prick test and the implementation plan for rare diseases. One thing having a plan, having it implemented is something different, and I want to echo those. But I think the surprising thing about rare diseases is, despite their name, they're collectively quite common, affecting at least 1 in 17 people in Ireland, equating to approximately 300,000 people, the length and breadth of this country. And this figure is likely to be an underestimation, with the true prevalence of rare conditions probably higher. And in a country like ours, a small country, it's likely that each and every one of us have encountered someone affected by a rare disease. And as colleagues have said, the path to an accurate diagnosis is fraught with challenges. The lack of specific knowledge and expertise often leads to significant delays in receiving proper treatment, placing a heavy burden on families and carers. And the anguish of being ill without a diagnosis, or witnessing a child suffering without recognition, is profound. Thus, securing an accurate and swift diagnosis is of critical importance. And turning to the point that Deputy Shortall made in relation to genome sequencing and access to it is vitally important. Now, last week, a number of us attended a family where there was a conference, an all-Ireland conference on rare diseases. And one of the discussions referred to a review article that has just been published in Genomic Medicine. And it's reviewing the use of first-line genome sequencing to diagnose rare diseases disorders. It's research that's been conducted in the US. It's a review article of research around the globe. And interesting in that particular academic paper is that it points out that the disparities in healthcare access and outcomes that are a persistent issue, that genome sequencing can help overcome this and provide a unique opportunity to bridge the gaps by providing equitable access to advanced genetic diagnosis. Implementing policies that promote genome sequencing accessibility can mitigate these disparities, ensure all patients, regardless of socioeconomic status or geographic location, will have access to state-of-the-art genetic testing. This approach not only enhances patient care, but also promotes fairness and equity within our healthcare services. The report goes on to highlight the initial costs of genome sequencing are balanced by its comprehensive diagnostic capability, potentially reducing the need for multiple and sequential genetic testing. And by adopting genome sequencing as a first-line test, we can optimise resource allocation, reduce long-term health costs through more efficient diagnosis and management of genetic disorders. And we need to consider the long-term benefits of this, not just looking at it in relation to acute or exceptional cases, but that it is available far more broadly in our healthcare system in this country. And that review article makes the economic as well as the healthcare case in relation to that. And I think that is of importance and cannot be ignored in relation to this. And Minister, 37% of patients in this country endure a gruelling 5-year quest to get a diagnosis. And Irish research reveals that children with rare diseases occupy hospital beds 25 times more than their peers. And yet, our efforts to harness the potential through a national genomic strategy for genetics and genomic medicine has been hampered by the recruitment process, by the embargo in relation to the recruitment of staff, and the absence of a designated home for a new central genetics and genomic laboratory. There isn't provision being made for it in the new Children's Hospital as of now. And I'm asking you, Minister, to develop the site that's going to be decanted in Crumlin as the centre of excellence in this country for genomics medicines, and put the resources in there and provide the accessibility, not just for people with rare conditions, but more broadly as part of a diagnostic healthcare tool, because it will save our health service, it will provide rapid diagnosis and ensure that far more people get timely care that they need. Thank you.